It's a great day to talk rehab. I'm Dr. Donald DeFabio. You got pain in the butt? Is it sciatica? Is it a psoas? What is it? Let's figure it out. A lot of people get pain over through here in their butt. Turn your back towards us. I mean right here. Hip pain. Oh, that's hip pain, right? Oh, it's sciatica, right? Oh, it's a sore butt. It's a psoas, right? Well, actually, it probably is. Research has shown that pain in here in the butt is usually coming from the hip over 70% of the time. It's not your sacroiliac. It's not your L5 facet. It's not your disc. It's not coming from the spine or the sacroiliac. Over 70% of the time, it's coming from the hip. And that is related to your psoas muscle. And that's why you got a psoas, because your psoas muscle runs from your spine down to your hip. It does this. That muscle that clicks when you move your hip, and it gets the popping inside, that deep popping when you move around. That's your psoas muscle. When that gets tightened and shortened, it doesn't lengthen, which then causes the hip socket to dysfunction, and then you get the muscles in the back overworking, they get sore. It gets painful. This hip joint has got to flex up and down. It's got to rotate in and out. It's got to extend back. It needs to do all those motions. See, think of it this way. Very simple analogy. Your bicep bends your elbow, right? Let's say the elbow can only bend that far for the sake of argument, all right? And I told you to bend your elbow. Go ahead, bend your elbow. Come on, bend your elbow. Come on, bend your elbow. He's going to keep trying to bend his elbow. The biceps is going to keep working. The biceps is going to get sore eventually. But it's not a bicep problem. It's because the elbow's not working right. Look at all the muscles that attach from here up across here, from here down to here, from here over to here. Look at all those muscles that attach across the hip. So when this isn't moving right, these muscles pulling all the time, and they get sore. What's the solution? Number one, restore motion to the socket. Number two, make sure those taut muscles are relaxed and become elastic again. And then number three, give you the appropriate exercises to keep it that way. So, how are we going to restore motion? Let's go face up for me, please. Lots of chiropractic techniques to restore motion for that. We like to use an adjusting block in the office because it makes lots of noise and we think the noise is cool. So we can put the block, I was just kidding, guys. We put the block underneath the hip. How the block works, it's a nice way to save my hands and very efficient and safe and comfortable for the patient. It creates inertia where the body moves and then it stops. And that inertial force creates motion of where I'm directing my force. So if the hip wasn't moving backward, I would impulse it down that way. It creates inertia. When the inertia goes, then I drop on it, and that creates a shearing force of the hip. And I can do it in rotation. I can do it in rotation. I can flip them over and do it in extension. Works really, really well. We can also do it manually with our hands. Lots of different ways to get it done. I can even use a machine that gets in there, an adjusting instrument. Works really well. The key is knowing what needs to be adjusted. What about soft tissues? Lie on this side. We have to address the soft tissues of the area. So we know there's all different muscles that run through here. So we just get in there with our hands. Draw this knee up towards your head. And we just work this whole area in through here. Draw the knee up to your head. Pin and stretch and active myofascial release. Bring the knee up, let the foot drop. Get all different planes in through here. We may have to work along the sacroiliac joint. Why? Because the hip bone's connected to the sacroiliac bone and the sacroiliac's connected to the low back bone. I mean, it's all connected. And that's why chiropractic rehab works so well. Because yeah, you gotta pain in your butt from your psoas muscle that's too tight, and I'll show you how we treat that in a second. But we not only just treat that, we look at the lower back, but we're also going to look at your knee. We're also going to look at your foot. We're also going to look at the balance of your core muscles, because it's all tied together. So we'll work in through here to relax any tight muscles in here. And then to get into that psoas muscle, let's lie on flip side. Again, a pin and stretch works really well, where I can just dig in there and grab it, and then we stretch it. A lot of times I will stretch the leg back and use a contract, relax, stretch technique, push, and then stretch to open all of this. All right? So to really be comprehensive in treating the pain in your butt is to look at all these variables. My job is to figure out what you need. Do you need lengthening and myofascial release of the psoas for your sore ass? Do you need local treatment of the glutes? Do you need an adjustment of the acetabulum? Well, maybe it is an L5 adjustment. But all those things have to be checked, treated, and then rechecked to see if we're achieving our therapeutic goal for the day. So that's how we approach it. Now, what about strengthening this area? Well, it depends on what needs to be strengthened. If there's weakness in through the hip region, we like to hit it with clamshells. Great exercise. Hips are stacked, feet are stacked. Just do it that way. Works really, really well. We can do some straight-legged, side leg, glute med raises. Bring the leg back, toe down. You can pump from there. Got to make sure you're feeling it here, though. All right? Sideline glute med raises like this are working hip flexors. Why don't we want to work hip flexors? Because all day long we're sitting and they're shortened and they're tightened. We want to lengthen those, and then we want to strengthen your glutes, because when you sit on them all day, they go to sleep. They become soft. They lose their tone. So let's go face up. Simple way to work the glutes are some basic bridges, but you got to engage them first. Pinch your butt, bridge up. Nice glute squeeze at the top. Hold it. 1, 2. Slowly. 1, 2, 3, 4. Pinch the butt, bridge up. Hold it. 1, 2. Slow. 1, 2, 3, 4. These are simple exercises that you can all do to lengthen the front, to strengthen the butt, and to help alleviate recurrence of your glute pain when it's coming from your hips. So, is your sore ass coming from your psoas, or is it just coming from needing a hip adjustment? That's your chiropractic doctor's job to figure out. Your job is to get in, get your treatments, and do your exercises. I'm Dr. Donald DeFabio. It's been a great day to talk rehab. Thanks for tuning in.